Hi, my name's Evan. I'm going to be your occupational therapist working with you today. I read in your chart that you just had surgery for tennis elbow or lateral epicondylitis. Because you had your surgery 3 days ago, we're actually able to do something to help you out with some of the pain that you're having in your elbow there. What we're going to do today is an ice massage. So one way you can do this is putting water into a paper cup and freezing it in the freezer and then peeling off the bottom of the cup. But what I did today was just prepare a frozen water bottle. And it's a little slushy. It's not totally frozen yet, but it'll work just the same way. So what you're going to do is using your opposite side, so whatever side doesn't have the pain, you're going to use the bottle. And what's nice about the water bottle is it produces condensation as well. So you get that, you won't have any rubbing or irritation on the site that you actually apply it to. You're going to want to put the bottle base right where you're having the pain, so right there at the side of your elbow. And you're going to want to move in circular motions. Now, you want to keep this on and keep a pretty firm pressure, obviously not pressing hard enough to, have pain or anything like that. But you want to keep this on for 3 minutes or more, but with a maximum of 10 minutes. You definitely don't want to go longer than 10 minutes. And you're also not going to want to do this 2 weeks after you've had your initial injury or surgery or anything like that. Because at that point, we're not really going to get a lot of gains out of doing that. But what's nice about this technique is you're getting everything, all the inflammation, everything in that body part that hurts to just sort of relax a little bit. And you're actually going to go through a few different stages. It's going to feel cold at first, definitely whenever you put it on. Then it's going to feel a little uncomfortable, to be honest. You're going to sort of have to deal with a little bit of discomfort at first. But after that, you get the numbness that we're looking for. And that numbness is what's able to soothe some of that pain that you're experiencing. So if you're able to make it through there, definitely try it. We're not going to want to do cold therapy or the ice massage therapy. Like I said, if you're more than 2 weeks out of your injury or surgery, we're not going to want to do it the first 2 days after it as well. So that 24 to 48 hours, we want to wait until after 48 hours. But since, like I said, you're 3 days, we're pretty good there. And then we definitely, if you are using like direct ice or something like that, like I said, you want to try to make sure that you're not causing friction or anything like that to actually hurt the skin. And you definitely don't want to just leave it in one spot. You want to be moving in that circular motion to really work out the area. If you have sensory issues or anything like that, maybe work yourself into it a little bit. Get used to the cold first. Get used to what it's going to feel like beforehand. And maybe have some towels around to be able to wipe off any excess water or dripping that you might get on yourself from the condensation. But other than that, it's a pretty easy procedure, but it will actually make you feel much better moving forward. Now, there are a lot of commercial grade ice packs and things like that, but you can get the same use out of everyday objects, like I said earlier, with the paper cup and water or just a water bottle like this. Thank you so much for your time. I hope this really helps you out. If you have any questions moving forward about it, please feel free to ask. The last thing I want to say, we definitely want to try to be as directed as possible. So the exact spot where you're feeling pain, you want to put that bottle right on that, and that's where you want to move around in the circles. So if I'm having pain right here, I want to take the bottle and put it directly on it and work there, because it's not going to help you too much to, numb the entire area. But yeah, like I said, if you have any issues or questions, please feel free to reach out, and I look forward to working with you next week. Bye.